As you might be aware, one of the things we'll be discussing today is the recent scientific advice that was published in November last year on One Health Governance in the European Union. This was a scientific opinion and evidence review report prepared by the Scientific Advice Mechanism. And several of our speakers were involved in developing this advice, and we're really looking forward to sharing that with you today. Just briefly, I wanted to introduce the Scientific Advice Mechanism and who we are and what we do. So we provide independent scientific advice and policy recommendations to the European institutions at the request of the European Commission. We're made up of three main parts. So the group of chief scientific advisors who develop advice and recommendations. And that's done on part on the basis of evidence that is gathered by the SAPEA Consortium of Academy Networks. So SAPEA is a Horizon-funded project that stands for Science Advice for Policy by European Academies, and who are connected to the European academic community. And finally, the third part of the scientific advice mechanism is the SAM Secretariat, who sit in DG RTD, and they act as a liaison between the group of chief scientific advisors and the European Commission. In terms of how the advice is developed, it starts when we receive a request to work on a particular topic, and that can also involve the development of various scoping questions to help guide the evidence gathering. The second stage is that the gathering of evidence, which is usually done by SAPEA forming a working group of experts from across Europe, and then putting together an evidence review report, which is shared with the group of chief scientific advisors. They then take this evidence, as well as reviewing other evidence, to develop their recommendations before delivering that to the Commission. So, as I mentioned, today we're going to be talking about One Health Governance. We've got a great set of speakers who I've shared with you there. And I don't want to take up too much more of your time before moving on to the first of our speakers, which will be Tyra Grove-Krause. And this, the only thing I wanted to just say in terms of housekeeping is that we've got lots of time for questions. Please put these into the chat. We'll be monitoring these, and we'll be asking them at the end of after all of the presentations. So with that, Tyra, can I hand over to you?
Yeah, thank you so much. I think I cannot share yet. Now I can. Yes. So can you see my screen now? Okay. So I'm Tyra Krause. I am a medical doctor, and I'm the executive vice president for the Epidemiological Infectious Disease Preparedness in Statens Serum Institute in Denmark. And we work with the surveillance of infectious diseases. And I have chaired this expert group together with Professor Jakob Zinstark, who was actually one of the founders of the One Health concept. And this expert group did the SAPEA evidence review report on One Health governance in EU. And it was really an inspiring group to work with, 17 experts across different countries, across different disciplines, and from different career stages. We have worked intensively on this review from March until July. There's been an expert review process and also a formal review process before the report could be handed over to the scientific advisors in August, where it was also published. So we also had some scoping questions to work from. So the overarching question was, considering a complex policy area as One Health, what forms of management and cross-sectoral collaborations are best suited to ensure that synergies, possible trade-offs, and unintended consequences are taken into account? And we also had three sub-questions. And the first one was, how should One Health be defined in the EU context? and which EU policies could benefit from the implementation of a One Health approach. And this about the policies that would benefit from a One Health approach is going to be covered in a speech by Lisa Boden later on, so I'm not going into this question. And then we also had to address which tools and leverage points are most suitable for building capacities, planning and implementing One Health in EU, and which criteria and indicators can be used to assess the effectiveness of implementation of One Health policies. So I have one slide for each question. So for the One Health definition, what we proposed was adoption of the One Health definition developed by the One Health high-level expert panel underneath the quadripartite. And according to this definition, One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of ecosystems. It recognizes that the health of humans, domestic and wild animals, and the environment are closely linked and interdependent. And in the ERR, we clarify the meaning of what is meant of many of these terms that are used in the definition. What is environment? What is ecosystems? What does it mean when it says integrated and unifying? And what is meant by closely linked and interdependent? And I think what is the most important thing here is that it's actually, by adopting this definition, it is a paradigm shift from an anthropocentric view on One Health, where the human is in the center, to a more ecocentric view, where you have to balance the health of humans, animals, and the environment. And we also described in the report that other concepts that are adjacent to One Health, like for instance a planetary health, should be approached as complementary and not competing to this definition. We also had to address these leverage points for building capacities, planning, and implementing One Health policies. And as part of this, we did a literature research on the benefit-cost ratio of One Health initiatives. And what we could see is that most of the literature that have tried to assess or done evaluations of One Health initiatives, they were focused on infectious diseases, and they also had this anthropocentric view on One Health. Almost half of the publications, they reported positive outcomes, but we could see that there was a lack of standardization in methods used to assess the benefits of the One Health approaches. We also included 6 case studies which were examples of successful One Health implementation. There was one on integrated AMR surveillance in Denmark, one on integrated West Nile virus surveillance in northern Italy, also one on trichinosis control in Europe. We also covered some One Health project on healthy cities and a study on the integrated laboratory infrastructures at SSI, that's where I work, where we have the human and the veterinary preparedness labs integrated in the same institute. And to also address non-communicable diseases, we also included a case study on impact of companion animals on human mental health. For the criteria and indicators to assess effectiveness of One Health implementations, we could see that there are a wide range of qualitative and quantitative indicators that can be used, and you can do cost-benefit analysis, cumulative cost assessments, and also game theory approaches. And there's just an example here in the graph where you can see that's from Jakob Sinstag, who has done some research in Czech in Africa, where he can show that if you want to do rabies control in humans, you can actually save money by a One Health approach by vaccinating the dogs and still giving post-exposure prophylaxis in the humans. But this illustrates that One Health implementation can actually be cost saving. We could also see that more research in the benefits of One Health approaches is needed. Often we forget to evaluate the benefits, and but we think that the currently available indicators, they are sufficient to assess the effectiveness of EU policies in operationalization of One Health. So we don't need to invent new indicators. We can use the ones that we already have, but maybe we need to have a more standardized approach on how to do it. We also propose different options for policy, and I've listed some of them up here. So of course we can see that coordination between local, regional and national governments and EU and the intergovernmental institution is really essential. You need to have political ownership and clear governance structures. We can also see that you need to have some financial support in order to get started, because it takes time to collaborate and also to build up infrastructures. We also propose to improve the integrated laboratory surveillance and response infrastructures for AMR and zoonosis in Europe. Then it's really important that we can evaluate the research, evaluate One Health implementation, and also do research in One Health implementation. And we need to improve the funding mechanisms for One Health research. And we also think there are opportunities for capacity building and training. There are a lot of more options suggested in the report, and they have all been very well embraced in the scientific opinion, I think. So I'll not go into detail with this. And I know that Lisa is also going to talk about the options for policy, for improving policy on One Health. So that was all from me. Thanks.
Great, fantastic. Thank you, Tyra. As I mentioned before, we're going to be saving questions for the end, but please do put them into the Q&A and we can start to look at them and we'll add those. Next, I'd like to invite Eva Zažímalová to speak. She is a member of the group of chief scientific advisors who worked on the scientific opinion and is a professor of plant anatomy and physiology at the Czech Academy of Sciences.
So, okay, can you see the screen and can you hear me, please?
Yep.
Perfect. So I must thank Tyra and Jakob for very perfect evidence review report, because really we as a chief scientific advisors are not real experts in the particular area, and for us the evidence review report that was provided by SAPEA and chaired by Tyra and Jakob was really perfect guide for us. So thank you. As already mentioned, we had some scoping questions from DG Santa and others. And based on these scoping questions, we also built our recommendations. And since, oh, sorry, it does not work, so I will stop sharing the screen and I will change it here. Sorry for this. Yeah, it's better. So this is the second slide, which should represent actually our recommendations. We divided the recommendations to two groups. One in the top of the slide, we call them top-down recommendations because they address definitions, governance, planning, and implementation. And the bottom part of the slide, recommendation number 4 to number 6, we call them bottom-up recommendations because they were related to capacity building, indicator surveillance tool, of course, education. And all those recommendations are interrelated, as we tried to somehow symbolize by the arrows. As already Tyra mentioned, concerning the definition definition, which is the basic thing to do. We use the recommendation by One Health high-level expert panel from the year 222. What I would like to stress is the fact that the definition is really overarching all aspects of the life on the earth. I very much like the small actually picture in the presentation of Tyra with the pyramid one and the circle one, because I think it is really very nicely it's very nicely depicting how the paradigm changed. And based on this recommendation number 1, we actually have some sub-recommendation that it is necessary to convene European Commission services to set out a collective vision in One Health topic for Europe, because if people would not accept the point of view or the general view of the topic, we can construct the best recommendation for governments and policy making, but it will not work. So it is very important to have some common vision what One Health is and how to deal with it. And of course, it is necessary to support regional One Health coordination mechanisms and health platforms, because again, Europe is very diverse, and one must take into consideration the diversity of European culture, European habits, etc., etc. So it's very necessary to consider local things as well. Then in recommendation number 2, we recommend to develop effective One Health governance by working across silos and creating links at EU, national and local levels. It is in other aspects more or less the same what I said before, and we strongly recommend to create a high-level One Health coordination mechanism, because there are a lot of activities in Europe that actually are not coordinated. And it is costly and it is not so effective, like if there is some real working coordination mechanism. Then we recommended to strengthen interinstitutional collaboration for developing an EU One Health strategy. And this must be supported on political level. This is another thing, that actually various countries in Europe have slightly different views on this topic. So it is really important to base the collaboration not only on interinstitutional collaboration, but also at political level. Then we recommend to arrive at common vision on how the EU is to engage on One Health at the international level. This is again a very important thing, because actually One Health topic is almost genuinely global topic. And even if European countries would agree on some vision or on some activities, it is really necessary to communicate with the rest on the earth, on the rest of the countries in the earth, because, for example, climate change or, I don't know, pollution and things like this, solar radiation, etc., this is really global. And even if we do the best in Europe and other countries will not, or vice versa, it wouldn't work. So, and again, we strongly recommend to support the sharing of good One Health practices across EU at national, regional and local levels. And of course, some national One Health strategies must be developed with a view to their implementation on European level. Otherwise, it wouldn't work. Here it is necessary to promote coordination at the regional and local level, to support multi-sectoral collaboration, and of course, which is inevitable, to enhance capacity building. And then some actions must be supported by adequate resources and funding. Of course, money are important, and in the what was very nicely documented in the evidence review report, even some costly actions that are related to improving One Health actually in the longer term can be very beneficial. Even cost-benefit analysis might be very positive for this. So this must be kept in mind as well. And what we recommended is to consider the establishment of a multi-stakeholder platform on One Health. So not only, let's say, coordination of action, but also coordinated effort to do something. Then recommendation number 3 is related to policies, to EU policies. Of course, we know that EU policies in this respect must be strengthened in relation to One Health and overall policy coherence. There are some particular areas that actually deserve some special focus. For example, health, but not only human health, but also animal and plant health, chemicals, environment and climate, food and agriculture, including food safety, food sustainability, nutrition, of course, research and innovation, trade, but also regional, urban and rural development. Tyra mentioned how important it is to consider this in relation to big cities, etc., etc. Of course, education. So what we recommend to develop a strategy with short, medium and long-term goals to match the United Nations theory of change and adapt it to local, national and European-wide needs. Of course, for the short-term example is integration of already existing policies and infrastructures, improve surveillance of emerging pathogens, for example. For medium-term, another example, establish an integrated surveillance, preparedness and response system, or, for example, demonstrated return on investment and reduced economic impact from One Health relevant threats. For long-term, sustainable livestock and agricultural development or enhance resilience of communities through better disease prevention. So these are just very brief examples. And now we go to the bottom-up recommendations. First one, recommendation number 4 in this case, is support education, training, data, and knowledge sharing. Of course, it is necessary to integrate One Health concept in education and training at all levels. It is necessary to integrate One Health principles in professional training. It's necessary to utilize new technologies like artificial intelligence or virtual reality for interactive and immersive learning and knowledge sharing. So this is the trend. So it is no need to repeat the reasons for this. And of course, promote public awareness of the One Health concept and practice. This is very important. Even if it is very soft recommendation, I think it is one of the most crucial ones, because if people, as I said, do not understand why, so they are not willing to do things. Recommendation number 5 is related to research and innovation. And here I will stress that it is necessary to identify and tackle the institutional and structural barriers that hinder inter- and transdisciplinary research. Tyra already was speaking about change of paradigm, and I think this can be applied also to researchers, because sometimes we tend to be very much focused on one topic, and we tend to subconsciously maybe ignore things that are around us in other disciplines. So this must be taken into account and to actually fight against this. And then we should ensure guidance, frameworks, and incentives that facilitate research and innovation across discipline and sectors. And here I would again stress both in academia and in the private sector. Because this should be collaborating on this. Of course, it is very important, and this is the question for researchers now, to develop integrated models and key performance indicators to assess effectiveness of One Health implementation. Because when we asked ourselves, I mean advisors, about indicators, key performance indicators, actually we thought that there are really gaps in research in this area. And of course, research must be supported in the nexus and cross-cutting areas. And there are many research gaps, just research gaps in One Health policy and governance, or surveillance and data sharing, behavioral drivers. These are very important. And of course, technological innovations must be taken in the account, and many, many others. Recommendation number 6, the last one, is to improve prevention, surveillance, and risk assessment that are related to One Health. And again, it is necessary to integrate already existing infrastructures for surveillance. And we think that this is really the challenge for the future to do this. And what I would actually comment on this, that already existing systems should be integrated into something which I would call sustainable emergence, sustainability, disease emergence. For example, also with meteorological and environmental data systems. And of course, we must combine surveillance systems for human and animals health indicators, also with surveillance systems for insects, environmental parameters, remote sensing, geographical information systems, risk mapping, and also mathematical statistical modeling, because it's also very important. And of course, again, we must somehow involve new digital technologies and integrate them to the surveillance and risk assessment techniques. So I think it was enough for me. Thank you.
Thank you, Eva. We'll move straight on to our next speaker, which is Professor Lisa Boden from the University of Edinburgh. Lisa was a member of a SAPEA working group on One Health and is head of the School of Veterinary Studies and Dean of Veterinary Medicine at the University of Edinburgh.
Thanks, Hannah. I just want to check that you can see the slides in the full screen mode. Okay, that's super. Thanks very much. So this presentation is really going to pick up where Tyra left off of her last slide, and it also threads, of course, and links back to what Eva has just said, in particular focusing on recommendations 2, 3, and to some degree recommendation 4, sort of underpinning that with some of the evidence from the evidence review report. I suppose at the outset, it's just to say thanks to Tyra and to Jakob and colleagues on the working group, because it was quite a significant task. And in particular, I'd like to thank Dominika and Stefan for the work that they did with me, in particular on the governance and policy areas that I'm going to report on. I'm going to go straight into some of the key findings. In the slides are set out where there are a couple of key findings on the first that pick up off from where Tyra left off. Then I'll talk a little bit about the institutional and stakeholder landscape, the policy landscape, and then I'll finalize with a way of linking it back to this slide in terms of operationalization. But what's important here is just to acknowledge the important dimensions and needs really for One Health governance and policy coordination to produce that coherent policy landscape, which start with leadership and political, institutional, and financial will, and a defined scope, as Tyra has already pointed out, around One Health, picking up and clarifying the definition as set out by the One Health high-level expert panel, and acknowledging that the definition moves One Health beyond the idea of the presence or absence of disease into understandings of well-being, and thinking about the societal well-being as a capacity to act, as well as equitable distribution of resources, sustainability, and preparedness over different timescales. And that means that we have to think about governance in a particular way, and I'll show you a slide in a moment around the complex interconnections between local, regional, national, and supranational, as well as international coordination that's required. And that then is underpinned by an understanding and identification of the different stakeholders, so that they can be effectively included for meaningful participation with really clear roles and responsibilities. And I'll highlight the importance of knowledge brokering, in particular for transdisciplinary approaches, transdisciplinary meaning bringing in non-governance, non-academic actors into the conversation. And lastly, recognizing the complexity of shared the policy landscape, largely because of the shared EU and member state competencies, but also because of the nature of overlapping regulations in the first place. So Tyra already mentioned that this was a desktop review. It was a time-sensitive desktop review. It required us to look at the literature, and in this chapter, particularly focusing on a literature search, first of all, the regulations and policies, and then another separate independent literature research of all the institutions at these different levels, international, supranational, Europe, and then local levels. And what that meant was that we were then able to then cross-reference those two things in order to try to find something comprehensive. This figure is a complex figure, and I'm not going to go into it in detail, but it is present in the report. And there are other figures too. I think this is figure number 3 or number 2 in that chapter number 2. And it highlights really the complex coordination between this local, regional, national, and international levels. In blue are the intergovernmental structures which really support the One Health approach and endorse the One Health approach. And in dark green, the areas from the European level, which are important and which highlight the importance of not only vertical but also horizontal communication, coordination, and collaboration. In yellow is the link to member states, and it's worth noting in the text there that those countries with integrated approaches which have already focused on disease outbreak preparedness or national action plans that have been transposed from the global action plans are more likely to be well set up in order to be able to operationalize and implement a One Health approach. The landscape in general is quite fragmented. Some areas have huge success in terms of and are well established in the One Health space, for example, antimicrobial resistance, and in terms of the more recent pandemic preparedness discussions. But it was observed that there might have been missed opportunities to really make One Health explicit in the Sustainable Development Agenda, and in particular, a missed opportunity around SDG 3, the Global Action Plan, and the SDG accelerators. And that's an important thing to acknowledge given the widening of the definition of One Health and understanding that One Health is really a precursor and a prerequisite to the success of sustainable development. There is an acknowledgement too that perhaps there may be better integration of One Health in multilateral treaties, and indeed that a lot of funding for One Health comes to the EU, so it is a center of gravity for One Health networks and partnerships, and it is the case that the reach of One Health goes beyond the EU, and it requires inclusion, equitable inclusion, and equitable partnership building with not only stakeholders within the EU but also out with the EU who come from rural, indigenous, and religious backgrounds, as well as other cultural areas, for appropriate representation. In this slide, I just wanted to highlight two things. One, the importance of knowledge brokering, and I think this may come up later in the discussion around examples of why that's important for transdisciplinarity through the cross-agency task force. The influence and agency of any kind of knowledge brokering or boundary organization depends, again, on political, financial, and institutional will. But there are lots of other examples. For example, at intergovernmental level, the EU Observatory for Health Systems and Policies, which articulates the science to the policy setting. Una Europa One Health has specific training programs that enable One Health at the science policy interface, and the European College of Veterinary Public Health does the same, and the UN Institute for Training and Research is useful too. The other thing that I've highlighted here just on the side is the European Court of Human Rights, and I think we're observing the transformative power potentially of case law litigation, and in particular thinking about the right to health and the right to One Health and a healthy environment. While we were writing the report, of course, there was a case that came to the European Court of Human Rights around that from Switzerland, which initially at least was successful. There's also an acknowledgement that we may need to look beyond existing legal frameworks to think about frameworks that go beyond anthropocentric approaches to consider natural resources and non-sentient beings, for example, the rights to rivers that are observed in other countries like New Zealand and elsewhere in the world. So if we move on to the policy landscape, again, this is a table that you'll find in the report, and it's only 3/4 of the table that I've presented here just for ease. But this is outlining EU policies that benefit from a One Health approach. And this was a reasonably comprehensive view of the types of policies. The table can be read at a glance, or it's meant to be read at a glance. At the top of the table on the right-hand side, the abbreviations or initials refer to human health, animal health, agriculture, environment, climate, economics, integration, and societal linkages and impact and engagement. And each of the policies are written on a single row, so the greener the row, the more aligned a policy is with the One Health high-level expert panel definition. Where you start to see light gray and dark gray, we're starting to see areas which could be better aligned to that particular definition. What's important as a takeaway is that there are sort of three main types of policies. One the first type of policy is in the top box, which are policies that should be One Health oriented policies, and which actually are very well aligned to that current definition. And there's some examples that you can see there from Health Security Council, Horizon Europe, etc. And the second group, which I'm going to come back to, are policies that should be aligned to One Health, but could be better aligned. And I'll talk a little bit about farm to fork, crisis preparedness, and EU biodiversity strategy. And then there's a third section, which I've not included in this slide, but which are policies that ostensibly fall into one or more sectors that could be related to One Health, but are really issue-based and don't necessarily require an integrated One Health approach. And that's important because as well as to make decisions about which of those policies should be. So I've not included those there. I guess the key features are, I've picked out farm to fork, crisis preparedness, and EU biodiversity strategy just to highlight that these are policies that are really important. Farm to fork, of course, is a cornerstone of the Green Deal. It is reasonably anthropocentric in nature, and in looking at it, perhaps could be strengthened in terms of its engagement with public engagement and society, and looking at integration. But perhaps the big trend really is that, or what was observed in the policies as they set out right now, is that those policies that seem to focus on health appear to be delinked or neglect to some degree environmental or climate change considerations, and vice versa. And so perhaps it's really just making clear that there need to be stronger linkages between the relationship between climate, nature, and health as a whole in policy development, and greater attention paid perhaps to the social and economic contexts in which they define them, but also have an impact on, and that requires some stakeholder engagement. This is the last slide I want to present, and it kind of harkens back to the first slide, but adds a little bit more detail, thinking about operationalization. And if I just take you around from 1 to 5, the focus really is on ensuring multi-sectoral and intersectoral approaches underpinned by this political, institutional, and financial will, and highlighting some of the features that have already mentioned around convening power through an overarching senior leadership and clear command and control, understanding how that particular issue fits in within a One Health conceptual framework, and the context more widely around legal frameworks that support it, and whether there is new and existing case law which could be transformative. And then already mentioned the potential for a coordination platform which would have buy-in and representation from leaders from different sectors. If we move over to 2, the importance of integrated and a unifying approach and working across silos is enhanced really through knowledge brokering expertise and boundary organizations which require sustainable funding. And that's important if we are to truly engage in a transdisciplinary approach that brings in non-academic or non-policy actors and engagement with wider society, so that these are brought in early on to develop and set common locally appropriate policy goals through a theory of a change model. And you can see within that little subpart of the diagram the emphasis on an iterative process of understanding stakeholder inclusion, participation, and responsibilities to highlight areas where there may be overlaps, where there may be areas which could become perhaps more efficient and effective. And it also highlights there that mainstreaming One Health is, in order to do that, you need education, training, experience. I've mentioned ECVPH and UNA Europa One Health already, but perhaps also opportunities to bring online data and online repositories of those networks. That is underpinned by blended approaches to public, private, and third sector funding. There is a section, which I haven't gone into detail here, around the types of funding that are important, but what's critical in principle is that that funding is transparent and balances the stability of the public purse with the agility of private funding mechanisms. And that leads us to the final component, which is around implementation at scale. And in order for that to be balanced and optimized and then scalable to move beyond a project paradigm, there needs to be pairing with monitoring and evaluation efforts, including standardized and harmonized metrics. And I'll stop there and hand back over. Thank you.
Great, thank you, Lisa, and it's great to see all the questions coming in as well. Our final speaker is Carlos Neves, who is from the European Food Safety Authority, and can perhaps talk a bit more about the implementation of One Health in practice. Over to you.
Thank you very much, Hannah. Good afternoon to all the colleagues online. Greeting here from sunny Italy. And indeed, thanks for the invitation to perhaps share a few ideas on how we're trying to do this also in practice. But I may be biased because together with agencies and DG Santé, we really pushed and helped shape this request. But of course, the first message would be a huge thanks to the colleagues, to Tyra, Jakob and the group, and then to the chief advisors for putting this on the table. It's a huge step for the union. We've been talking a lot about it. Now it's here. So we've moved forward a lot. You know, small step for men, huge step for mankind. So let's stick to that. But this has been on the mouths and on the mindsets of politics in Europe for a very long time. And perhaps, like for many other things, COVID was a game changer as well in this, I think, in this mindset. And just to bring you an example, the European Parliament already in the summer of 23, when they finalized their COVID report analysis, making two very clear messages and pleas to integrate One Health. And they went further to actually establish an European cross-agency task force dedicated to One Health. And when the Parliament requests the voice of the people, it's a command. So we were already thinking on how to materialize this, and this was a push to get it done. And so already in November 2023, we got to launch this cross-agency task force for One Health, bringing together the European agencies which are providing scientific-based advice to the Commission, to the member states, on a variety of topics that fall within the remit of One Health. The European Centre for Disease Control, the European Chemical Agencies, the Food Safety Authority where I sit, the European Medicine Agencies, and the European Environmental Agency. So we got together, we launched it. Strong support, I'm happy to report, from our member states, from our commission. You see there, some of you will recognize there in the picture, our two One Health Commission heroes, so Director General Galina and the Director for the One Health Directorate in Santé, my colleague José Domenech. So we launched it. And then it was time to brainstorm. We launched it, and now what will we do together? Took us a few more months, but already last May, and this is available online, we concluded on what is our plan of action, our action plan for things that we promise we will do together. This was launched in May, and then from May until this autumn, we were keeping our fingers crossed that the chief advisors would come up with something that would fit more or less what we were doing. Otherwise, we had to get back to ground zero. And One Health telepathy, the alignment is perfect. We're very happy here. And in this picture, what you see is on the center, the 5 key areas of activity of this task force. And you will see that the different recommendations, I didn't put here recommendation 1 on the definition because we have accepted the definition as a dogma almost after 25 years of discussions. But you will see the different recommendations fitting within the scope of areas where this task force is developing work. Strategic coordination, research coordination, capacity and communication, stakeholder society engagement, and partnerships and really joint activities. So far I've shown you what's on the paper, but I think most of us that live in the One Health will recognize the challenge sometimes is to go from paper to action. And I wanted to share just a few examples in this limited time of words becoming action. And in these next slides, I wanted to illustrate first on the left side, 2 examples of 2 reports, 2 activities that the European agencies do together. One about the zoonosis report of the Union, released on an every year basis, and the other one on antimicrobial resistance. This is released every 3 years. And these are good examples, not just because they bring agencies together under this One Health approach, but because behind these reports are then 27 member states and associated countries that have provided the data, the expert knowledge, the discussion, the assessments. And this is, I think, a perfect example of this approach transforming to reality. And on that one, on the antimicrobial resistance, which comes every 3 years, the next one, hopefully, will even bring finally some environmental considerations as well. The next picture you see there is from a Twitter, is another area. You see that, well, it might be too small for you to notice, but that's 2 of the agencies going together to Kosovo on our capacity building activities. The Union has a program to create capacity with our future member states that will join, hopefully, the European Union in the future. And it was important for us to come together, and we cannot, go there, the food safety on a Monday, the medicals on the Tuesday, and the environment on a Wednesday to repeat the same message. Let's get together and let's share with these colleagues a program and build capacity together. And the last is 4 logos that many of you will recognize, perhaps, representing 4 large-scale European research partnerships. And here the European agencies have teamed up together to participate, but very straightforward, to influence and to try to advocate for the research that we need these people to do. Because the only way for me to provide the scientific advice to the Commission on topic A, B, and C is that the science is there. And in this picture, partnerships on chemicals, on animal health, on AMR, on future, you have just on those 4 logos more than 1.5 billion euros of research money being distributed right now across the Union. And we want to make sure that, among other things, they sort out some of our problems. Sounds a little self-centered, but our problems are the problems of the European citizens. And I'll leave you one teaser, because this is a project that is about to be launched in a few weeks. The European Commission will get, for the first time, a scientific opinion on a topic, in this case, azole resistance, where all agencies together, including in this case, actually also the Joint Research Center of the European Commission, we've come together to provide one single opinion. So the Commission as well has changed by not asking all of us individually 5 reports, but telling us, guys, get together. We want one single piece, and then we want to understand how this problem impacts the environment, the people, the food, the animals, and how can solutions be truly pushed forward. So we hope the managers now have on the table a document that, consolidated, will provide easier chance to take action. So this was just a few examples of how this cross-task force is trying to bring this into words to action. And I wanted to leave my last 2 slides with a plea and a message. And the first one is really, I think I call it Carpe Diem Europe. Seize the day. We have now on the table these recommendations asked for the Commission. So we are hoping the Commission will act on it. We have a quadripartite joint plan of action that the European Union and its member states have fully endorsed. And together with my colleague Jakob Zingstad, we sit on these OLEP advisors, helping this GPA to become a reality. And we're happy that Europe is on board. We have smaller contributions like our cost task force. And even the last report you see there from IPBES, the famous Nexus report, European member states have approved this. And One Health is one of the approaches being proposed to really integrate biodiversity, food, health into the future. And if this was enough, let me guarantee you, the big boss has also told her Commissioner for Health that, and this is, of course, Ursula von der Leyen telling our new Commissioner, Oliver Valherli, you will continue to build the One Health approach. The momentum is here, we need to catch it. But my last plea is it won't get sorted out just by convincing Brussels. And I end up with, not with a Venn diagram, I'm not a very big fan of Venn diagrams, but I like puzzles. So I would end up with telling you that if this is going to work, we really need these 4 pieces of the puzzle to come together. We need a political and management leadership that will be active. And now they have plenty of documents telling them how action can happen. We need a society that needs to continue to be more interested. And education from the kindergarten all the way to the professionals is a focus. We need the private sector of funding schemes, as the recommendations highlight, that really need to be convinced that this is something where the return of investment is beyond description. And we need many of us, scientists, researchers, and professionals, to really team up. We may sometimes fight for funding, we may sometimes be very sector or silo-oriented, but without us as well coming and teaming up, this won't happen. This transformation, this takes time. It's transforming mindsets, it's transforming ways of working, and it's perhaps, if you want to be romantic, transforming hearts. Thank you very much.
Thank you very much. We've had lots of questions come in, so we've got about 10 minutes, and I thought I would just start with one which has come, which is maybe a bit more abstract in general to get us going. And that's I think probably directed to everyone. I think any of you might have a take on this. In terms of the paradigm shift from an anthropocentric to a more holistic approach in respect to One Health, which I think was mentioned in Tyra's talk, the question is this an overarching theme that you also see in other research areas? And will science eventually move from science with and for society to science for Earth systems? So I don't know if anyone would like to volunteer for any thoughts on that. Eva?
Just a comment. I don't see a discrepancy between those. I think it is just natural change of the thinking, and I think that the more the world is globally connected, the more we realize that everything is interconnected, including climate change. So I don't think a discrepancy in this, but this is my personal view.
Thanks. Anyone else, or we can go to the next question?
Just to clarify the question, if I could, Hannah.
Yeah.
So the question is, does the understanding of equity and social justice go beyond this idea of a One Health approach into other research areas? Is that sort of the question?
I think that might be what the question is getting at.
I think that we're at a sort of a moment in this. I'm speaking from a personal view, not from a working group point of view here, but I would suggest, I guess, that with the ideas of interlinked crises and looking for transformative change requires us to sort of decenter ourselves in different ways and really sort of interrogate the idea of what equity means in terms of our understandings of the world's resources and where we fit into that. And so I think it should and possibly will extend, if it doesn't already, into other disciplines, not just in thinking about Earth systems from a positivistic point of view, but also from the arts and humanities and more reflective understandings of our role in society and in the world as we know it as people, and from which I suppose takes it back to an anthropocentric view, given that we're reflecting on ourselves inside that role. But nonetheless, I think it's something that is quite cross-cutting and necessary.
Thanks. Okay, so I think going back more towards One Health and the governance aspect, I think this was a question that came in after Tyra's talk, that's saying that you talk about coordination between the different levels, local, regional, and national, is essential. And the question is asking who is responsible for that coordination. I don't know if that's something that came out in the evidence gathering process.
Well, it's a very difficult question, but I think, of course, we have there's a responsibility at the national level, and it's easier to have that responsibility, or it's easier to implement something if we also have a clear EU vision on this. And I think that's what we can see now is coming out. So I think it is easier for us to implement a One Health approach nationally if it is also implemented at the EU level. And when we implement it nationally, it's also easier to work with a One Health approach at the regional level. So I think it's like we get inspired from each other. We get inspiration from EU and to the national level and to the regional level and the other way around. And many of the case studies we present in the report as good examples of One Health implementations. They have been done at the regional level, but could also be implemented at the national level and at the EU level. So I think it goes both ways.
Carlos, have you put your hand up?
No, I fully support what Tyra just mentioned. And it's also the recognition that these three levels, of course, when you look at regional and national levels, there is always a variety of realities. Even within Europe, where we want to say we have an European Union, but there within we have a variety of realities. And also a reality of very different governances. And for those here living in Europe, you will remember that issues like food and agriculture are centrally managed by Brussels, while the health of people is a national competence. So very different approaches to some of these topics in One Health. But what I think Tyra mentioned is that first, let's not ever undervalue the importance of keeping all of these three elements moving together. I mean, this report is a big push at the highest topmost level to really, at the top, make a change. But this now needs to make sure it cascades down, or sometimes vice versa, that, as you mentioned, regional things can be brought and scaled up. And if we don't keep these balls all rolling more or less at the same time, we get either the frustration that it's policies that are high level that never materialize, or the opposite, where local initiatives don't seem to grow because they don't find space to grow. Funding, complex legislation. So this is a thing that I think policymakers will, in each country also, will have to think a little, again, recognizing that different realities need to be taken into consideration to make these levels move forwards. But I would go back to my last slide and say, no matter the level, at the end, and being here perhaps a little anthropocentric, the people, the ones deciding at the national, the international, the regional, or the local level are still just us. Human citizens, consumers, voters, for those of us that can vote in many places of the world. And this power to make change can also and should also be included here, and is very often forgotten, I think.
Thank you. I think a related question that also goes back to your last slide and talks about the puzzle pieces is again about responsibility. And so who should have responsibility for uniting the puzzle pieces that you presented? I don't know if you have any thoughts on that, or again, if it's maybe it depends on the different levels that you're talking about.
I would perhaps go back to accountability, something that, you know, we should share it, all of us. You can say the responsibility now lies with the big political responsibles of the union who should take these decisions. All of them have been elected just last May. So technically speaking, the accountability is with all of you who voted and in 4 years can vote again. But then I would also say accountability lies with, if you want to transform mindsets, I mean, all of you that have children these days, I'm teaching them when they are 4 or 5 to separate the garbage, you know, biological go here, plastic go there. Some of this mindset belongs to the education that starts at that level. So accountability will also change nationally, internationally, but it's no point just to pushing it to the next level. There is this tendency, push it to the next level, because they are the ones who have the power to make a change. Well, I'm happy that I live in a space where the power to make a change actually is with me. I vote for them. If I want to be very straightforward. So if I'm not happy.
Yeah, that's great. Thank you. Looking at the governance, Lisa, you talked a lot about knowledge brokering agencies, and I think someone has asked whether or not the term knowledge brokering could be explained.
Well, so I sort of use knowledge brokering and boundary organizations slightly interchangeably here and a bit loosely in the description. From what how I might apply that, a boundary organization would be an organization which would have a foot in multiple kind of domains, whether they are political or geographical or institutional or disciplinary domains. We often talk about in an academic setting, one of the big challenges is actually the disciplinary mobilization of knowledge across those types of boundaries. And we think about knowledge brokering, knowledge translation, knowledge communication, brokering meaning an exchange of knowledge, of different types of knowledge, where those brokers, if you like, are fluent perhaps with a deep technical expertise in one particular area, but with fluency across more than one area, to be able to then situate and contextualize information in a way that's appropriate for the next audience. And I think that becomes incredibly important when you're moving information from science into policy. And of course, that requires some particular expertise, and I referenced before the training expertise and education tools that are offered by things like Una Europa and UNITAR, as well as others in terms of ECVPH. so it's about really trying to be able to translate information in a way that is meaningful. So you have the science policy industry, the interface, the industry policy interface, the science policy and academic interface, but also if we are serious about transdisciplinary working, it's about being able to translate that information into language that anyone can understand. It goes back to the points I think made by Carlos, Eva and Tyra around the importance for public awareness, public engagement early on, and in an ideal world, co-design and setting together of common goals that are locally appropriate in thinking about intervention. So I've gone a little bit beyond the question, but I suppose knowledge brokering is really about that that expertise in translation and an understanding and empathy for the audience for whom you're translating that evidence or information for, with an understanding too of how that information will be acted upon. So it's quite a thoughtful process.
Thanks, and also absolutely links to what Carlos was saying around citizen engagement and voting and knowledge sharing. So I think one final question, there's one around whether to coordinate regional, national, EU levels, should there be an ART 185 set up around One Health? I
can give a try on that, Hannah. This is about the funding systems for those not familiar with the EU jargon. This is about the capacity to establish large-scale research programs on key central topics for the Union. And the answer is, well, it's in the hands, of course, of policymakers. We are about to launch ourselves in the preparation of a new framework program for science, FP10. There was an attempt to do this on the Horizon 2020. Many of you will remember the EGP One Health, when we tried to put One Health in the research agenda. When we moved to Horizon Europe now, it's difficult also to have one single program to cover everything. We've seen a little, perhaps, and this is perhaps my personal opinion, a little back into the silo. So we have a program just on the AMR, a program just on the pandemics, we have a program just on the food systems, we have a program just on the animal health, we have a program just on the chemicals. You can, of course, argue you can't just put all of that and then run a 2 billion euros program. Well, can and can. Some programs are run for 2 billion euros and they still deliver. But I would say that this is again now something to be considered as we embark in preparing the new framework program, and it's the next year that we'll decide how to tackle this. So, but that it needs to be tackled, I would say, goes beyond any doubt.
Thank you. I think we've just got time, I think, for just one quick one that I'm going to ask each of you to maybe give what you'd see as the sort of number one thing you'd want the people who are still here to go away with, and the biggest opportunity for One Health in the EU and implementing it. So shall we start with Eva?
Okay. I would say I have two messages, if I can. One is that we can have ideal governance and policy making. However, if the society would not accept this, it is for nothing. So this is the first one. And the second one is that we should not restrict our way of thinking to Europe. Europe is actually a small part of the world, and this topic is typically a very global one. So I think these are two messages I would like to say. Thank you.
Thank you. I'm just going to go around my screen now. So Lisa.
Thank you. I suppose I would support Eva's first point there. I think for me it's around equitable partnerships and partnership building. And secondly, I suppose I'd highlight again the relationship between understanding and policymaking, the relationship between health and our natural environment and ecosystem around us, and making sure that those are efficiently and sufficiently linked in policy considerations.
Carlos?
I think I go back to my last slide to really tell, if you're listening to us still, it's really this carpe diem, grab the chance. So if you're listening and you're a politician, act. There's enough documents on the table. If you're the private or the funding, team up, open your purse and understand that this is an investment that will benefit you. If you're one of us scientists, let's really team up, guys, because we can do a much better job and we serve better the citizens if we go together. And if you're just curious or interested about One Health, if you're a society, remember that curiosity drives change. And at the end, that's how we will get this to work.
And Tyra, final points. Oh, you're muted still.
Yeah, I think it's in the same line as Carlos, that we all have a responsibility for One Health implementation, independent on whether you're at the EU, the national or the regional level, and independent of whether you're a citizen, a scientist, or a politician, or a private company. So we should all work for this.
Fantastic. Thank you very much. So thank you all. I'm sorry we didn't get to answer all of the questions that came in, but we'll definitely look at those going forwards. And I encourage you to go and have a look at the Scientific Advice Mechanism website, where both the evidence review report and scientific opinion are. Thank you very much for coming, and thank you again to all our speakers.
Thank you. Have a nice day.
Bye.
Thank you. Bye.